So since this is all about virtual health, it probably makes sense that I'm virtually here with you. And I think what I want to really convey today is how appreciative we are that you're as excited about this as we are. But this is why it's important. Every place I go around this country, people are talking about why physicians aren't excited about the future. At Jefferson, we're excited about the future. The reason we're excited about the future is we're leading these initiatives. Instead of us reacting to somebody doing telehealth and saying, boy, why didn't we get into that? We're leading that, and we're doing it the right way. We're doing it around our commitment to excellence, and we're doing it as part of reimagining healthcare education and discovery to create unparalleled value. You are the leaders, you are the pioneers, you are the ambassadors, not only for Jefferson Telehealth, but for the new Jefferson as an innovative, entrepreneurial, academic entity that's going to be one of the leaders in the new healthcare future. So thank you for being here and have a good time.
Hi, I'm Judd Hollander. I'm the Associate Dean for Strategic Health Initiatives at the Sidney Kimmel Medical Center. My role at Jefferson is to help reimagine healthcare and make it more patient-centered. For example, what we are trying to do is build a healthcare system that's not about the hospital, it's not about bricks and mortar, it's about providing care to patients in the manner that patients want to receive care. So we're changing the patient care model by making patients the center of patient care. And that sounds really, really silly. But for too long, what's happened is patients had to fit into the doctor's schedule. They had to go to the doctor's office. They had to get the procedure done when it was convenient for the doctor. And now what we're trying to do is say, okay, you're the patient. Let's take care of you when, where, and how you want to be taken care of. And we're doing that a variety of ways. One of our big projects is actually telemedicine. It's what we're calling Jeff Connect. It's actually coordinating the care for the patients, but the patients choose when they enter the system. So for example, the patients can hit an app on their iPhone or Android device, and they can immediately be seeing an emergency physician 24 hours a day, 7 days a week. The patients will call the shots. When doctors round in the hospital, right? Doctors round when it's convenient for doctors, and patients' families aren't often there. We're now video conferencing in the families, so the families could join rounds when they can't physically be at the bedside. It's opened up a whole line of communication that we've never had before, and it's not focused on the doctors and nurses. It's entirely focused on the patient. So we started with a really simple concept. I ran around the university when I got here and said to people, what are the problems you have? But I didn't just say it to administrators or department heads or division directors. We said it to patients, we said it to frontline care providers, and we said, what are the problems? And then we sat down effectively with 4 million pieces of paper and said, what are the themes for the problems and what are the ones we could solve with some kind of technological solution? And then what are the problems that we can make patient-focused, that is easy for people to understand? A is better for the patient than B, so let's do A. And we basically decided on creating a large telehealth program and a chain of urgent care centers so the patient could get care when and where they want it. So one of the first things we created was virtual rounds. We found out that patients are unhappy that their family members don't know what's happening when they're in the hospital. In fact, family members are even more unhappy than the patients. So what we did is we developed a system so that when we round on patients, we could video conference in their family members. We've been able to video conference in family members across the United States, 2-3 family members at a time, bring them into the bedside so they could be there with their loved ones and the healthcare team, and everybody could be on the same page. On the more creative side, we're doing the 24/7 urgent care. So there, patients can now hit an app, talk to an emergency physician 24 hours a day, 7 days a week. And if they need further testing, they don't need to go to the ER. Maybe they could go to an urgent care center. Maybe they could get it done as an outpatient. It's wherever it's most convenient for them. Make it really easy for patients to get the care they want. They don't have to make an appointment and wait 3 weeks to be seen. Well, the world's changing. I mean, you look around and the world's simply changing, and medicine is the only thing that you can't do on your smartphone. And it's time medicine caught up to the rest of the world. So we think that's a good time to change. The other thing is the healthcare system as a whole has changed recently, and we've moved away from this fee-for-service model where docs and healthcare institutions were paid based on the volume of tests they did. So if I had somebody with back pain who may or may not need surgery, turns out I got paid more if I did surgery. I don't think we really made decisions that way, but we really didn't try to avoid the expensive or more revenue-producing procedures. In the new world where it's value-based care, in essence, we're going to get paid by delivering value-based care. It's taking care of the patient with the highest quality while actually not spending more money. So if I could take care of a back pain patient with physical therapy rather than with 6 weeks in the hospital and major surgery, I should be reimbursed more for it. I won't actually get reimbursed more for it, but it's better for the whole system. And the reimbursement to the institution might not be different. So if we spend less money, we'll do better. And so I think the idea is if you don't want to be spending a lot of money on healthcare that's low value, that doesn't help people, let's take care of people as best we can, as soon as we can, not let them get worse. Really simple. My vision for healthcare is that anybody could get the care they want when and where they want it. Shouldn't have to wait 3 weeks for an appointment, shouldn't have to get biopsied with something that might be cancer and have to wait 10 days for the appointment. The minute the results are known to somebody, we should be able to call you and tell you, good news, it's not cancer, rather than you have to be petrified for 10 days. So it's really about putting the patient front and center. And it's all about care anytime, anywhere, as soon as possible. It's not about when it's convenient for the doc or nurse. It's about when it's right for the patient.